Hi viewers, today we will be dealing with one of the conditions in cardiovascular system. All competitive nursing exams contain cardio questions and students find it difficult to attempt such questions. This video will deal with the cardiovascular system and questions pertaining to it. Today we will deal with angina pectoris. When we take the history from a patient, he or she would say, "I feel like an elephant sitting on my chest." Have you ever come across such a situation? Angina is chest pain, which means strangling feeling and squeezing or crushing of the chest. The chest pain is caused by the insufficient blood flow to the coronary artery resulting from atherosclerosis or coronary artery spasm or increased myocardial spasm. The main goal of treating an angina is to reduce the progression of acute attacks leading to the risk of myocardial infarction. There are mainly three types of angina: stable angina, unstable angina, and prince-metal angina. Moving on to the first one, stable angina. Stable angina is also known as exertional angina. This angina occurs with activities and exertion. In this angina, when the patient takes rest or nitroglycerin, the symptoms are relieved. The next one is unstable angina, also known as pre-infarction angina. In this type of angina, the symptoms or pain are not reduced by rest or nitroglycerin, and the pain symptoms last longer than 15 minutes. It is a life-threatening condition which can lead to heart attack. Lastly, prince-metal angina, also known as variant angina, occurs mainly due to coronary artery spasm. Here, the pain may occur at rest and may be associated with ST segment elevation noted on ECG. Moving on to the signs and symptoms that we can see on patients. They are pain. Here, the chest pain radiates to the neck, jaw, shoulders and to the left arm. Then sweating, pallor, dizziness, dyspnea, digestive disturbances, tachycardia and hypertension. Moving to the diagnostic studies, which include ECG and obtaining the lab test values of troponin and cardiac enzyme, which are always normal, and cardiac catheterization can also be done to get the information about the patency of the coronary arteries. Now, what are the nursing responsibilities? Assess the pain, start the oxygen administration, provide continuous cardiac monitoring, administer prescribed nitroglycerin, stay with the patient, ensure that the bed rest is maintained, and place a patient in a semi-Fowler's position. Simultaneously, put IV line and obtain a 12-lead ECG. Let's discuss the surgical management. To restore the blood supply to heart, invasive procedures like percutaneous transluminal coronary angioplasty and maybe coronary angio bypass grafting are required. Now coming to the medical management. The medical management includes the following drugs such as nitroglycerin, calcium channel blockers, cholesterol lowering medications, beta blockers and antiplatelet medications. With that, we end the theory part, and in the practical session, let us look at the questions on angina pectoris. Let's look at the first question. The nurse is teaching a client to receive nitrates for the relief of chest pain. Which of the following instructions should the nurse emphasize? The four options are: A. Repeat the dose of sublingual nitroglycerin every 15 minutes for 3 doses. B. Store it in a cool, well-lit place. C. Lie down or sit in a chair for 5 to 10 minutes after taking the drug. D. Restrict alcohol intake to 2 drinks per day. Hope you have got the answer. The correct answer is C, because nitrates primarily helps to relax the coronary smooth muscles and produce vasodilation. It can cause hypotension, which makes the client dizzy and weak. So we instruct the patient to lie down or sit in a chair for 5 to 10 minutes after taking the drug. So let's move on to the next question. A patient is admitted for treatment of prince-metal angina. When developing the plan of care, the nurse keeps in mind that this type of angina is triggered by A. The activities that increase myocardial oxygen demand. B. An unpredictable amount of activity. C. Coronary artery spasm. D. The same type of activity that caused previous angina episodes? Here the correct answer is C. Prinzmetal angina resulting from coronary artery spasm means that the muscles of the artery tightens or constrict. So we choose option C, coronary artery spasm. So viewers, I hope these tips would help you to understand about angina pectoris. We have started our regular nursing courses at Medcity International Academy, Tiruvalla, and for more information contact us in the given numbers. Thank you.